So let me turn to Shaykh Yunus Dudhwala. So we know this, and I'm sure that most of our communities, as I'm talking specifically about Muslim communities, recognize how severe this problem is. There is a sense of panic going on in some of our Muslim communities. Now, how is this affecting the Muslim community? How is it affecting each individual in the Muslim community? How is it affecting the families? What's the general feedback that we're getting in terms of how Muslim families are reacting to the severity of the coronavirus?
Bismillahir Rahmanir Rahim. So I think if we look at how this has been in the news for some time, and people have been watching it and saying that, thinking that it's at a distance, it doesn't concern us, it doesn't affect us. But slowly, we've seen how Saudi Arabia has shut down totally in terms of Umrah, in terms of Haram, in terms of Medina Munawwara Jummah this week. I mean, many of you might have heard the khutbah from Medina Munawwara and Makkah Mukarramah. And, you know, it's been devastating for those people who went for Umrah. Flights have been cancelled. So everyone's lives, whether they're Muslim or non-Muslim, has been affected. And in our communities, I mean, we've seen panic buying going on. Unfortunately, prices being risen, which has affected many families. And then we've seen our masajid and makatib being affected. Especially in the last week or two, we have had many masajid, especially when the schools announcement was made last week. The maktabs that are running throughout the UK especially have had to close down. Some will be carrying on online, inshallah. And then many masajid have had to restrict public access to 5 times daily salah. Only a few individuals are performing the salah. So everything is changing. Everyone's lives are changing. And I think from a Muslim perspective, our concerns will be that once the masajid have stopped public access and there's no Umrah, there's no spirituality, how are we going to keep that spirituality?
Yes.
How are we going to connect to our communities? And I think
before we go into the question of spirituality, there's always a very big concern about compliance. And is the Muslim community complying? Now, I was just listening to a very dear professor, somebody who I've been working at Bradford Royal Infirmary, and he's just put out a video. And when I was talking to him, he was saying that this video, I hope, reaches the Muslim community more than anyone. And that's quite interesting. He was saying that. And he was describing Bradford. So Bradford is an area where there's a cluster of Muslim, many Muslims around in Bradford. And there are, we tend to be very communal. We sort of regularly go, we've got extended families. Not only that, but we also have, my background is I was a commissioner. So I understand the demographics of places like Bradford. So even our morbidity rates. So morbidity is basically the number of disease conditions that exist in the Muslim community tend to be on average, in the UK anyway, higher than relative to some of the other communities. So, we're more sort of vulnerable to heart disease and diabetes and various other things. So also, the other issue is in terms of the fact that there is a frailty index that we look at. So, usually around about the age of 65, 70, people tend to be more frail when they go above that age. But this tends to happen at a lower age in, the South Asians, specifically more so in Bradford. So he's got a real concern. He thinks it's going to impact places like Bradford or clusters of Muslim communities in Bradford, many other places around the world, probably more so than any other community. So is our Muslim community, are they really looking at this realistically? Are they compliant with this? Are they socially distancing themselves? Are they isolating themselves? What's the general situation in the Muslim community at the moment?
Well, I think if you look at the queues in the shops and the shelves which have been emptied by the Muslim community, I don't think we've been very compliant so far. Yes. However, I think the more the messages are coming out, especially from the Imams, especially from, Boris Johnson was very clear today that if people don't stop mixing, then they might have to put some powers in place. Right. So I think we as a Muslim community need to be at the forefront of understanding the severity of this illness, how quickly it spreads. Dr. Munir is an expert in this area. Yesterday when we listened to him, today when we listen to him, it's very, very clear. This social distancing, physical distancing is extremely important. And if we don't do it, we as a Muslim community are already being pointed fingers at for other reasons, unjustifiably. But this time it will be justifiable, and we will be picked upon very, very easily. As, for example, yesterday there was an article that 28 people who in West Midlands were tested positive. It came from a church. If one mosque is found to be the cause, that will be a field day for many tabloids. So we need to really, really adhere to the guidance that we are being given.
And recognizing there are certain cultures that exist with a lot of the South Asians, mainly I'm talking specifically about UK, but clearly we have different countries have different sort of ethnic backgrounds. But, you know, we have a culture of, you know, communally getting together regularly, you know, and so forth. So, you know, it can be very difficult to get the balance right there.
I mean, for example, I mean, let's look at today. In the UK, it was Mother's Day.
Yes.
But I saw many social media posts of my non-Muslim friends who are outside their mother's door, but they did not go and meet their mother, just talk to them from outside. They are adhering to the guidance. And yes, we also have we have a very strong culture of looking after our parents, looking after our families and staying with families. But this is a time that we really need to make sure that our health takes priority, because what will happen to families is that we will be distanced. As if, Allah forbid, anything happens, families will be distanced at the most important time of their lives, which is happening today in hospitals.
Okay. So I think there's something about mindset as well, isn't it, in terms of how we perceive this. Let me give you an example. I went to a masjid not too long ago, and there was one of the elders, and I was talking to him, and I was saying, look, you're frail, you're old, you should not be coming to the masjid, you're putting yourself at risk. And his response was,